Popular questions from our group this week. Foregoing antibiotics for mastitis if fever went away.
So we had a group member who had mastitis, had a high fever, was prescribed antibiotics by her OB, and then the fever broke, and she was, working with, getting massage and getting that clog out. She said, well, now that the fever is gone, can I skip the antibiotics? Because she wasn't crazy about the idea of antibiotics. So that was the question.
So I would say I would start with the diagnosis. So we're talking about mastitis related to pregnancy, related to breastfeeding. So lactation mastitis. And it's a clinical diagnosis, usually 1 versus 2. And usually, when people call you as a doula, often they call you before they call me. Hey, Kaylee. So I have this breast problem, it's pain, I'm feeling some achy, I feel like I have a flu, fever, and chill.
Usually starts with a clogged milk duct, and then will progress to that infection.
So initially, especially if the fever isn't high and persistent, it may just be symptomatic treatment with NSAIDs and massage and whatnot. But if diagnosis is true, that is mastitis, then our recommendation would be 10 to 14 days of antibiotic. With true mastitis, it's not one dose. If we use something like dicloxacillin, it's 4 times a day. And if you took 1 or 2 and, my fever broke, then you probably didn't have mastitis. But if it takes a day or 2, then you probably had it. It's important to continue the antibiotic, minimum of 10 days, and continue breastfeeding. But I think the diagnosis is where the problem is, because sometimes, it may just be engorgement, maybe clogged duct, not necessarily full-blown mastitis. And this is where having someone you can speak with
makes a big difference.
Doula, perhaps, lactation consultant. But eventually you want to probably speak with someone who can advise you in case you need antibiotics. That phone call will save the headache.
Yeah, and it's no fun. I've had mastitis before. It's pretty miserable. But it's something that you can prevent. So if you notice a clogged duct starting, so a hard, painful lump in your breast, there are a lot of things that you can do to get that clog out before it progresses to an infection. So that's the time to reach out to, your doula for some tips, a lactation consultant, an IBCLC, and see if you can get ahead of the issue. Because true mastitis is not fun.
I mean, if I'm going to breastfeed, I'm thinking, if I'm going to prepare, I would want to have a lactation consultant in place right before I give birth. And I tell patients, even if things go well, you should just run things by your consultant the first week, right?
Absolutely. With my first, I was very lucky, and that breastfeeding came very easy for us. We never had any issues. With my second, I was cocky, and I was like, I breastfed my first, and everything's great. And the lactation consultants in the hospital were like, let me look at your latch. And I was like, yeah, we got this. We're fine. And sometimes when you're in the hospital, that damage doesn't start to build up. It takes a little while for everything to get uncomfortable. And then when I got home, I was cracked and bleeding, and he had jaundice, and I should have had someone look there in the hospital, because I thought I knew what I was doing, but it was a different baby. He had a different mouth, different, everything's different with each child. So having had someone look at it ahead of time and said, this is a shallow latch, let's readjust like that, would have made a big difference, I think, in that first week or 2 postpartum. And after one visit with a lactation consultant and some little tweaks, we were great. I healed up really well. He cleared his jaundice, no problem, and we breastfed for 2 years. So,
as far as pain is concerned, I prescribe fair number of my patients. I prescribe that Apno all-purpose nipple ointment cream, which pain in the ass because insurance doesn't cover. It costs $65-$70, and patients ask. First of all, it works because it's a combination of ibuprofen, antifungal, some steroid mixed in coconut oil. So it works. Anything with coconut oil works, right? $65-$70, and often patient says, can you do prior authorization? Oh, my, you know what?
Yeah.
And this is where classic example where insurance company should just cover.
Yep.
Because it's so helpful. And for some patients, it may be a little too much money.
Yeah.
But Apno, man, that stuff works.
The big thing I'll say about Apno cream or any type of ointment like that, it works and it can help, but it's a Band-Aid. You're not going to fix the issue unless you correct the latch and work with an IBCLC or a CLC. So if the latch is what is causing the damage, which most of the time that's what it is, and you put the cream on and it makes you feel better, but then you latch the baby on again and they're not latching correctly, they're going to keep causing that damage. So while the cream might make you feel better, you're not getting to the root of the issue. So it's one of those things where you want to use that in combination with the proper support and making the changes and the corrections to latch. So